Good afternoon, everyone. Thank you so much for joining our PSYCKES training webinar focused on getting access to our PSYCKES application. And this webinar is hosted by the Office of Population Health and Evaluation. So here's the agenda for today's training. First, we'll go over a PSYCKES overview, which will include some information about the PSYCKES application, like what data is in PSYCKES, what the population is, and a little bit about what quality indicators are and why they're so important. Next, we'll talk about best practices or some recommended tips that you can use when you are implementing PSYCKES at your organization. And this is important to review even before getting access because it will allow for your organization to plan for getting PSYCKES access. You can prepare for your organization and those who will be using the application. And then we'll go over how to actually put PSYCKES into your organization established procedures. We will also talk more about how to sustain those practices as well. Then we will shift gears to discuss the process of how your organization can obtain access, including the process of requesting access to the application itself, and also cover who is eligible for PSYCKES access. I will also go over our Authorization Management System portal, and this is where the security manager will grant access to PSYCKES for the organization's staff members. We'll go into some details about the AMS application and talk about how you can enroll and manage PSYCKES users at your agency. And lastly, I will go over training and technical assistance and provide some additional resources that may be helpful as well. And we will leave some time at the end for any questions that you may have, and we can answer that on air as well. All right, so starting with an introduction to our PSYCKES application. What is PSYCKES? PSYCKES stands for the Psychiatric Clinical Knowledge Enhancement System. This is a secure and HIPAA-compliant online application for sharing Medicaid claims and encounter data, as well as data from other state administrative databases. Our PSYCKES application is designed to support data-driven clinical decision-making, care coordination, and quality improvement. Please do note that in PSYCKES, we have ongoing data updates. So the data in the quality indicator reports are updated on a monthly basis, whereas the client-level clinical summary is updated on a weekly basis. Now, who is viewable in PSYCKES? We do currently have over 13 million individuals viewable in PSYCKES, and it includes individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or state psychiatric center inpatient or outpatient services, or health home outreach or enrollment. So if your recipient falls within this population, we will have the data available. Some examples of the data that you will find in PSYCKES includes details regarding clients' general medical health information, behavioral health details, residential information, lab and pathology details, as well as many other types, which we will cover briefly in the next few slides. All right, so in our introductory slide, we mentioned that PSYCKES includes data from many databases. So let's take a look at what data is available in PSYCKES. We have a few different data sources feeding into our application. So going over the first one, we have our clinical summary, and it provides 5 years and beyond worth of data. And again, it's updated on a weekly basis. Our biggest data source that we have is Medicaid billing. So all Medicaid fee-for-service claims and managed care encounter data is coming into our application across treatment settings. I do want to mention that with Medicaid billing data source, there is a bit of a lag from the time the service occurred to the time it shows up in the application. For example, something like medications, we consider those a little bit quicker with a quicker turnaround time from the time the medication is picked up to the time it shows up in PSYCKES. And it could be as short as 2 weeks. But things like outpatient and inpatient services, it can take a couple of months from the time the service occurred to when it shows in our application. And that's why we have our other data sources. And those would be our state administrative databases as listed on the screen. So these are more real time with a 0 to 7 day lag. So let me mention a few here. So we have our New York City Correctional Health Services. So if somebody spends some time in jail-based care setting, we will have that data in our application. We also have Department of Homeless Service data for New York City, and this gives you the shelter name, the program type, the placement data, and exit date along with the exit reason, as well as the shelter director contact information. Then we have the health home enrollment and CMA provider information from DOH MAT. We have the name and the contact information for the health home in our application. And if somebody spends some time in a state psychiatric center, we have state psychiatric center electronic medical records, the EMR data feeding into PSYCKES. We have assisted outpatient treatment provider contact, ACT information, residential and adult housing program information coming from CARES, and then suicide attempt information. We do have that coming from NIMERS, and this is all available data. So even if a suicide attempt occurred 15 or 20 years ago, that would still show up in our application. And then we also have safety plans, screenings, and assessments that can be entered in by providers in the application through PSYCKES My Choice. And lastly, we have intensive mobile treatment, AOT referral under investigation, and mobile crisis team data information coming in from DOH, MH, Maven. So in these PSYCKES introductory slides, I mentioned a wide variety of data that feeds into the PSYCKES application. So all of this data is available in the application in different types of reports. So firstly, we have the individual client level reports, and this is going to be the clinical summary. So this is the Medicaid and state administrative databases treatment history and provides up to 5 years worth of data and beyond for some data elements. We then have our provider level reports, and there are 4 different types of this report. We have the MyQR reports, which you heard me mention in the past few slides. Here you can review the names of the clients who are flagged for a health condition or treatment issues. If you are a provider level user, you would enable access to get this information for that specific recipient. And you can also apply many different filters that you may be interested in. Similarly, for recipient search, you can run ad hoc reports to identify cohorts of interest. You can also look at a list of recipients in different advanced views that will provide additional information columns. If you are a provider level, if you do have this provider level access, this is also where you can enable access to view a client's clinical summary. And then moving on to our usage reports, this is used to monitor PHI access by staff. So when you go to the usage tab in PSYCKES, you can see which team member from your facility has viewed a client's clinical summary or has enabled access. And then we also have our utilization reports, and this is to support those providers that have value-based payment data needs. Lastly, we have statewide reports, and this is quite similar to my QI report. So through statewide reports, you can look up a quality indicator and review statewide proportions by provider location or client location, and you can further narrow it down to client or providers, county or region. So through statewide reports, you can pull up proportions based on networks and providers as well. And I do want to mention that these reports are at an aggregate level. All right, so moving to our quality indicators, also known as quality flags. So what exactly are these quality flags? So OMH has identified a number of health conditions or treatment issues that are quite important. And what PSYCKES does is that it tracks clients who are positive for one or more of these health conditions or treatment issues. This way, the provider, the managed care plan, the local county, or even the state government leadership can be made aware and take necessary steps. And these flags can support clinical review as well as quality improvements. Another thing I want to mention in regards to these quality indicators is that we also provide the information as aggregate data, which will allow you to view the prevalence rate. And again, it would be at a program level, at the agency level, managed care plan by region or state. So you can peek at these prevalence rates and compare them to identify opportunities for improvement. And at the bottom, we have our performance tracking indicators, and this comes from New York State Department of Health. So these indicator sets include many of our substance use disorder quality measures. So while Psyche's quality improvement report is updated on a monthly basis, DOH calculates these performance tracking indicator sets after a 6+ month billing data maturation period to allow for service invoicing. So when you navigate to My QI Reports tab in Psyches, the as of date reflects the most recent performance tracking data run by DOH. And these measures are based on a 12-month. A very brief introduction to our Psyches application. Now I want to shift gears to best practices. And these are really just some lessons learned and some tips that are not required, but they have been proven to be useful to some organizations during the implementation process. So here we have these best practices organized into 4 different categories. And I will go into each of these best practices in more detail, but what we have on the screen here is sort of an overview of what some of the recommendations are. So the first step that we have is regarding planning. So when you are planning for your agency to get access for Psyches, you can contact the Psyches help desk, and there will be some documents that you will complete in return, and then you may want to establish a Psyches work group and determine some of the Psyches use case at your agency. And again, I will be going over into these specific points in much more detail pretty soon. But then we'll go on to preparing for Psyches access. So there is a protocol that you'll complete for granting users access to Psyches individually. And then you may want to develop policies and procedures, as well as prepare devices and train designated staff members. And then once you put Psyches into use, you can also establish procedures into practices for using the application. And you may want to develop a plan to sustain those practices. All right, so we will start by talking about the planning process for Psyches. And this process is really going to be unique for each organization depending on their place in the process. So some organizations may already have these steps completed, but for the purposes of this webinar, I am going to go through all of the processes from the beginning as if the organization is brand new and doesn't have access to Psyches yet. All right, so the first part that we have is the planning section. So if your organization is interested in getting access to Psyches, the first step is to find out if your agency already has Psyches access. And to do this, you will email our Psyches help desk at psyches-help@omh.ny.gov, and we will be able to let you know if your agency currently does have access or not. If we do confirm that your agency does not have access, then you can find out if your organization is eligible. And on the screen, I have a list of types of provider agencies in New York State that are currently eligible for Psyches access. So just going down through the list, we have agencies with state license programs or programs with OMH oversight. We have DOH recognized health homes and care management agencies, agencies with OPWDD licensed programs, federally qualified health centers, local government units, New York City Department of Homeless Services, state agencies. So that includes OMH, Department of Health, OASIS. We also have behavioral health networks. So some examples are BHCC and IPAs, Medicaid managed care plans, DOH licensed hospitals, OMH designated adult home and community-based services. And lastly, we have our freestanding medical clinics. And if your agency isn't on this list, please feel free to still email us at the Psyches Help email, because we are always looking to add new access types and new organizations to our application, so we can further investigate on our end and see if that is something that we can do for you. All right, moving on to our next slide. So after determining if your agency is eligible, the Psyches Help Desk team members will send you a confirmation email letting you know that your agency is eligible, and we will also provide you the next steps, which will include completing the Psyches Access online contact form survey, which is available at this SurveyMonkey link here. And your organization will also be provided an electronic Psyches confidentiality agreement, and that will need to be filled out and signed by your organization's CEO or executive director. After that Psyche's confidentiality agreement is electronically filled in and signed, you just need to return that to Psyche's help desk via email. And I do want to mention that we will be providing detailed instructions on how to fill out this form, as well as all of the relevant information is going to be included in the email sent from the Psyche's help desk. All right, so now here is some more information on what you'll need to provide on the Access Online Contact Form survey. So we do ask for some contact information like name, title, address, phone number, and the email address for the organization's CEO or executive director, the COO, or deputy director, two Psyche's point persons, and then any additional Psyche's point person that you wish to add. You'll see that for only the CEO, we do ask for a fax number, and we will also ask for the taxpayer identification number and the Medicaid provider ID if applicable. So for the Psyche's confidentiality agreement, I did wanted to kind of do a little bit more of a deep dive into it. Again, so for this form, the organization's CEO or executive director will sign the agreement. And if you do have someone other than the CEO or the executive director that will be signing the confidentiality agreement, that person must have the legal authority to do so. If we do receive a confidentiality agreement that is signed by someone other than the organization's CEO or executive director, then we will just request to verify that the individual who signed does have the authority. And if we do need to do that, we just request that you send us an email with the CEO or executive director letting us know that it is confirmed that this other individual does have the legal authority to sign on behalf of them. And that is the proof that we need in order to accept the confidentiality agreement. So by signing this agreement, it acknowledges that Psyches provides access to Medicaid claims data and protected health information. So you are agreeing to comply with all New York State and federal privacy laws and regulations. And these agreements will also be countersigned by our Psyches director. So here we have this screenshot of what the Psyches confidentiality agreement looks like. And if you take a look at the top section, this is showing the top of the first page, which explains that this is an agreement between the New York State Office of Mental Health, and the organization name will be filled out in this first box. I do want to point out that this is a fillable form, so you can type this out, you can save it, and you can send it back to us. And then the next step here is to also add in the date of when this agreement was signed. And then at the bottom, we also have this another box where you will enter the provider's name. And then the second image on the bottom of the page shows the last page of the confidentiality agreement. So the bottom of the page 5 is where you'll see the final section titled Authorization. So after reading the agreement, this is where the organization's CEO or executive director or another legally authorized individual will complete their name, date, and signature for the agreement. And then again, after these areas are completed, you can save a copy and return the agreement to the Psyches Help Desk for our director's signature. All right, so we do recommend establishing a Psyches work group, and this is a list of some of the people that you may want to include. So leadership buy-in is great, and we have learned from a lot of the organizations that Having the support of leadership is really important because they're the ones that can encourage and promote the use of psyches at your organization. And then having medical staff can also be really important because they can promote the clinical use and explain how psyches can help staff, especially with accessing client information and treatment planning. And then it is also helpful to have a point person who can organize and oversee the project and be able to explain to staff how they can get access and how they can also access psyches trainings and other resources that are available as well. And then we have our quality manager. Having them may be useful to coordinate utilization of services. Then we have our training staff. It's always good to have the training staffs, and we've noticed that some organization may have staff that work to train and organize onboarding for new employees anyways. So psyches training may be something that could be incorporated into other trainings that you may already be providing for new staff. And we do have a training webinar called Psyches Train the Trainer. We do have that available. And what this webinar does is that it offers a lot of helpful tips on how to do psyches training at your organization. And then coming down to the list, we also recommend having administrative staff and a clinical staff a part of the work group, because these are great people to have that can help discuss the current workflow and how psyches can fit into your existing workflow, especially for things like obtaining and managing psyches consent with clients at your organization. And then finally, you'll want to, of course, include the staff who will be using the psyches application. So after establishing a work group, you may want to think about potential uses of psyches and how people could use it at your organization. So which staff could use it, and how it can be integrated into the existing workflow to really improve efficiency and figuring out how psyches can fit into what you may already be doing. And one question to help determine that is whether psyches is going to be used for clinical support, quality improvement projects, or population health management. So those are really the three main area that we see psyches used at organization. The organization case will really help determine how psyches can be implemented. So we have the client level clinical summaries, which are used to support clinical reviews, treatment planning, care coordination, and discharge planning. And then we also have our MyQI report in psyches, which is used to support those quality improvement projects. And lastly, we have our recipient search and utilization reports, which again can support population health management. All right, so after establishing a work group, you can prepare for psyches usage. So when preparing for psyches use, we recommend not only developing policies and procedures, but also documenting them. So we have some example policies available for using psyches in clinical setting, but it's really important to obtain any administrative approvals if you are implementing something new at your organization, and to have those workflows supported by all departments that may be involved in these changes and the use of psyches. So we recommend that preparing psyches forms and psyches consent form. It is really one of the most important things to do when developing your policies for use of psyches at your organization. More specifically, the procedures for obtaining that psyches consent and having the consent form easily available are quite helpful. And it's also a really good idea to have a procedure for including that consent form that is signed by a client in their chart, or uploading a copy of that signed consent form to your electronic medical record portal. And there can also be an internal form or checklist that you can create, or if you already have one, you can also revise that checklist to incorporate the psyches procedures to really provide a thorough instructions for whoever may be obtaining consent at your agency. So let's kind of talk about the workflow of consent process. So when your organization is thinking of implementing PSYCKES, the workflow of the consent process, again, is really important. So when a staff obtains client consent or determine that it may be a clinical emergency, this can be done by anyone on your team who you think is appropriate to get information. So it could be a clinician, it could be an administrative staff. So it is helpful to have copies of the PSYCKES consent form printed and available to the staff members. And you can also integrate the consent form with other paperwork that the client may already be filling out during their appointment. So establishing this process is quite important because it will help with the efficiency of getting clients' consent, especially when there may be other circumstances that require some modifications. All right, so once a client does sign the consent form, someone at your agency that does have PSYCKES access will be able to log into the application, and then that person can use the recipient search to attest to your right to access the client's data. And again, workflow is really important here because the staff that may be obtaining that signed consent form may be different from the staff who is enabling consent and logging into PSYCKES to enable consent within our modules. When establishing who will be doing this, it is important to know that any PSYCKES user at your organization can access client data in PSYCKES once the consent is entered into the application. So any users who will be able to go into the PSYCKES application and look up that client to bring up their clinical summary, and they can have that available by exporting to Excel or PDF and putting that in the client's chart or EMR. And again, that's really valuable because clinical summary can provide up to 5 years worth of data on client across all different treatment settings. And I do want to mention that we do have other consent forms available that also have the PSYCKES language, and those would be the BHCC patient information sharing consent and the DOH health home patient information sharing consent. All right, so now we briefly discussed the consent process workflow. I'm going to move on to preparing devices. So when preparing devices for PSYCKES access, you will see that you'll need to have internet access, compatible browsers, and PDF readers. And PDF readers can be really helpful when you're using the export to PDF functionality in PSYCKES. And clinical summary is basically where we have a lot of information that you can export. And you can also export the QI reports as well as the recipient search results. So you'll want to have that on your computer. And I think most of the computers do already have a PDF reader built in. And another thing that you can do is save PSYCKES as a shortcut on your desktop or in your favorites. So it is recommended that you bookmark the home page, which is www.psyches.org, and not the login screen where you enter your user ID and passcode. So when you bookmark this specific homepage, the www.psyches.org, it will bring you to our PSYCKES homepage, and you will be able to find this blue button that you can click on, and it will ask you to enter your user ID and passcode in order to log in to the application. Sometimes when people have favorites where they have favorited the actual login screen where people enter their user ID and passcode. If you have that bookmarked, it may cause some login errors. So again, we do always recommend that you bookmark the PSYCKES homepage and not the login page. And I do also want to point out that we do have PSYCKES mobile apps. It is available in both iOS and Android. All right, so moving on to training the designated staff. So you have established the consent workflow process. You also have all of the devices prepared. So let's discuss a little bit more on training designated staff. So when training designated staff, you'll have the security manager that will need to be trained on how to use the OMH Authorization Management System. And this is how individual users are granted access to PSYCKES. Then you'll want to train the PSYCKES user on functionality of each of the tabs and reports that are available in our application. And if the designated trainers for PSYCKES may not, if they don't have enough time to cover each of the functionalities, we do have our recorded training webinars available on our website for each of these topics. So staff members can also kind of go through all of these recordings and familiarize. And staff should also be trained on PSYCKES related workflows, so documentation, privacy, and information security procedures. Because PSYCKES does use protected health information, it is really important to make sure that all staff members understand the policies and procedures for using this type of information. And then we do have resources available, like our training, recorded training videos that I mentioned previously, as well as user guides that you can find in our public website if you go to www.psyches.org. And again, mentioned in the previous slides, we do have the PSYCKES Train webinar, which gives more detail about how you can train staff in using PSYCKES. So now we'll discuss putting PSYCKES and established procedures into use. So after you've planned and prepared for PSYCKES implementation, PSYCKES can be put into use in accordance with the plan that's established by your work group. And it may be helpful to have frequent users of PSYCKES application available when your agency does get access so that they'll be able to monitor operations and identify any challenges. And after spending some time planning and putting these procedures and workflows into practice, it is important to sustain those practices. So some of the things that can be done to sustain practices are auditing the use of PSYCKES. So this can be done by checking the PHI access module and seeing if staff are using the application and also how they are using it. So when you have a new staff, it will be helpful to provide access and trainings. And then when staff are no longer working at your agency, their token will need to be deactivated by the organization's security manager to revoke their PSYCKES access. And monitoring the PSYCKES usage plans and making any necessary changes when the staff members are no longer at the agency. And then lastly, the PSYCKES usage reports are available for monitoring use, and I'll show you what that looks like in just a bit. So this is where the usage reports can be found. So if you go to this usage dropdown, you can see at this top toolbar, once you select this usage tab, there are three different types of usage reports. We have PSYCKES user, PHI access module, and clinical summary. So if you select PSYCKES users, it will give you a list of every single PSYCKES users that are linked to your facility. When you come down to this PSYCKES access module, this is where you will be able to see which staff member has enabled access for a client in PSYCKES. So you can also see if they have entered PSYCKES consent or if they entered the clinical emergency attestation. So if you'd like to take a look at which staff member has enabled what type of access, you can come to this PHI access module. And then coming down to the clinical summaries, this is also a great tool if you want to take a look at which staff member from your agency has viewed a client's clinical summary. So for the first one, when you select PSYCKES users, here you have the provider name. You can also sort of filter through this date range. So if there is a report that you'd like to pull in between a specific time frame, you can enter that information here as well. And you also have this graph interval section where you can select quarterly, monthly, or weekly. And again, if there is any additional filters that you would like to apply, those options are also available. So this usage reports tool is a really great tool to have in order to kind of see how PSYCKES is being used at your agency. All right, so next I'm going to talk about PSYCKES access protocol in much more detail. So let's take a look at the protocol for PSYCKES access. So the first thing that you want to do is complete and return the documentation to obtain organizational access to PSYCKES. So basically, to do a little bit of a recap, you can contact our PSYCKES help desk and ask whether your agency is eligible for PSYCKES access or not. And once we provide that confirmation, we will send you the required documents that needs to be filled out. So that would be this confidentiality agreement, as well as the PSYCKES online contact form survey over SurveyMonkey. So once you have all of that completed and returned to us, you will then sign the CNDA for access to AMS, which again, AMS is the application that is used by security managers at your agency. So once the CNDA is signed, we'll come down to number 3. So you'll want to designate security manager. And then the security manager is who will enroll PSYCKES user at your organization. And the security managers can also revoke PSYCKES access when staff members no longer require it. And I will be going over each and every single one of the steps in much more detail in the upcoming slides. So let's start with the confidentiality and non-disclosure agreement. So in order to get access to the Authorization Management System, which is the application that the security managers need to log into in order to grant PSYCKES access to individual staff members. So the CEO or executive director will need to first sign the confidentiality and non-disclosure agreement, also known as the CNDA. And it is really important to note that CNDA is different from that PSYCKES confidentiality agreement. So while the PSYCKES confidentiality agreement is signed for PSYCKES access and co-signed by our director, the CNDA is different because this is an OMH document and it's defining your organization's responsibilities with regards to information obtained by any and all OMH applications. And it's required to ensure that an organization understands its responsibilities regarding access to and use of that data. So this must be signed before getting access to AMS. All right. So what is the Authorization Management System? I've mentioned AMS quite a handful of times, so let's discuss that. So OMH Authorization Management System, it is a web-based application, and this is what organizations will be using in order to authorize staff to access certain OMH applications. So this is not just specific to PSYCKES. This is where organizations can go in to provide access to other OMH applications like Patient Characteristic Survey, CARES, NIMERS, MHPD, and PSYCKES is also part of this. So in order to grant PSYCKES access to individual staff members, security managers will need access to this portal. And again, the CEO or the security managers are designated by the CEO, and once that access is granted to the security manager, they will be able to log in. So completing registration in AMS. So the CEO has signed the CNDA, which granted them access to AMS. So if an organization already is registered in AMS, which means that an organization has already has security managers, you do have an option to keep the security manager the same, or if you can if you want to add a new security manager, you will be able to do so as well. And in order to do that, in order to add a new security manager, you will need to contact the CEO or executive director and have them send the AMS self-registration, also known as AMSSR email, from the CNDA portal. So I will show you a screenshot of what that looks like, but basically the CEO will need to log back into the CNDA portal, and they will be able to send this AMSSR email to the person who will be granted that security manager role. And if a CEO or ED is unable to log into the CNDA portal, we recommend that you contact the OMH help desk. I have their email as well as phone number listed here, and they will be able to further assist as well. So through this AMS portal, the security manager will be able to enroll PSYCKES user when PSYCKES organizational access is granted. So this is for when the organization is already registered in AMS. But if an organization is not already registered in AMS, there are several steps that needs to be completed. So after the PSYCKES online contact form is completed and the PSYCKES confidentiality agreement is emailed back to the PSYCKES help desk, the facility CEO or executive director will receive an email from ITS with the CNDA portal, and it will also contain the login instructions. So the email will be sent to the CEO or executive director identified in the submitted PSYCKES contact form. The email is going to be sent from ams-do not reply at its.ny.gov. And it's typically sent within 1 or 2 weeks after the document is submitted to our PSYCKES help desk. And I do want to point out that the email subject line will read granted access to confidentiality and non-disclosure agreement. And the email content is going to include a user ID, login instruction, as well as this unique link to the CNDA application. So what we ask that the CEO do is that once they review the CNDA, they have to select this checkbox to agree to the terms and conditions. And in order to sign the CNDA, you can select this accept button. And we do have a link to our CNDA user manual, as well as a specific pages where you can find detailed instructions on how to complete the CNDA process. So here are several screenshots of our confidentiality and non-disclosure agreements. So once you log into the CNDA portal, you have this agreement listed right here, and you also have the option to kind of scroll down to read it, or you also have this option to view the entire agreement. So once you read the entire agreement, it will have this authorization and electronic signature section. And here, when you have to make sure that you select this checkbox, saying that you agree to the terms and conditions, and then you can either cancel it, or you do have the option to print this agreement as well as accept. So when you select accept, it will give you this confirmation message. So it says, by clicking the confirm button, you are confirming your electronic signature of the CNDA. So once you select confirm, it will take you to this screen where you can see this green banner at the top of the screen, letting you know that the CNDA has been successfully signed. And when you want to review this CNDA agreement at a different time, once you've signed it, if you'd like to pull it up again, it's always going to be there. So you do have the option to kind of refer back to it at any point in the future as well. So once you have signed this, as you can see, you have this navigation pane on the left. So this is where the CEO is going to come and send the self-registration email to the security managers. So as you can see, when you select this send self-registration email, there are going to be 2 options. So the CEO or the executive director can also sign themselves as a security manager, or they can also designate different individuals for the security manager role. So if you come down to this left navigation pane, right under home, you should be able to see this send self-registration email. So as mentioned previously, when you select send self-registration email, it's going to give you these 2 options. So the first one says, I will be the new security manager, and you can select this if the CEO or the executive director would like to designate themselves as the security manager. But if they would like to elect another staff member, they can select the second radio button option, which is, I need to send an email to a new security manager, and here you can enter their first and last name. So this would be the security manager that you'd like to add, their first name and last name, as well as their email address. So once you complete the required information, you can click submit. So once the CEO has sent this CNDA email to the designated staff member, the email is typically sent within 24 to 48 hours after the CEO has sent the selected the option in the CNDA portal, and it is sent to the CEO or executive director or selected staff member who will be assigned that security manager role. And again, this is going to be sent from ams-do not reply at its.ny.gov. And we do have the subject line, response within 24 hours, Authorization Management System, self-registration for security manager. So the email content includes, and this is if the CEO or executive director elected themselves as the security manager, it's going to include their user ID, token request information, as well as the authorization management system's URL. And again, if uh, the email is, or if another staff member is designated that security manager role, the email content is going to include the description of the security manager role and as well as the AMS self-registration link. And I do really want to put an emphasis on this. That AMS SSR link is going to expire in 24 hours. So it is really important that the security manager is monitoring their inbox and being on the lookout for this email and ensuring that it is completed within the first 24 hours. And if you would like additional information as well as instructions with screenshots, we do have this AMSSR user manual. It's going to be in the same CNDA user manual from pages 5 to 9. So once the designated staff member is given the role of a security manager, they're going to receive the AMSSR email, and it is going to include instructions, and detailed instructions are also available in this AMSSR user manual link. So after the self-registration is complete, the security manager is going to receive this confirmation email, which is going to include following details if applicable. So we have 3 different scenarios. So the first one is if the security manager does not have an OMH user ID, is going to be one that is going to be created for them. So the confirmation email will contain their new user ID and instructions for obtaining RSA Secure ID token. If the security manager already has a user ID but does not have a security token, the confirmation email will contain instructions for obtaining an RSA secure ID token. And if the security manager already has the user ID as well as the security token, the confirmation email will contain instructions for using AMS to create user accounts for their agency and to assign access to OMH applications like PSYCKES. So depending on whether they have the user ID and or token, the confirmation email is going to vary slightly. And this is another important note. So security managers can grant themselves access to PSYCKES. So if a security manager logs into AMS using the user ID and token, they will be able to create and grant PSYCKES access to staff members, but it is also recommended that they grant themselves PSYCKES access so they can help with any technical issues, as well as monitor usage, since they will be able to log into the PSYCKES application and go to that usage tab. So just a heads up to ensure that security managers are granting PSYCKES access to themselves as well, since that option is available for them. All right, so moving on to the next slide. So this is a screenshot of what the AMSSR registration form is going to include. So at the top, you'll see the facility information. So facility name, address, city and zip code. And then if a security manager already has an existing OMH user ID, they can kind of come down to this drop down and select their user ID. And at the bottom, this is where they'll fill out their information. So the ones with the red asterisks are a required field. So first name, last name, email address, title, phone number, address. So these are some of the information that the security manager can enter. And if they would also like to take a look at the confidentiality and non-disclosure agreement, so the CNDA, this link will direct them to that so they can review this as well. So in order to complete the AMSSR registration form, they have to ensure that they select this checkbox that indicates that they have read and agreed to the CNDA. So once all of this information is filled out, the submit option is going to show up, and you'll be able to select it. All right, so that was kind of an introduction on how a security manager can be designated and what are some of the things that needs to be filled out before doing so. So now let's kind of dive a little bit deeper into determining PSYCKES users. So the work group can determine the staff that will require PSYCKES access and whether or not they already have an OMH user ID, and staff who will be responsible for enabling PHI access, which you can do so by using recipient search or the registrar menu. You can also designate staff who will be able to go into the registrar menu and fill out or print out that PSYCKES consent form to have on hand. And then lastly, the enrollment information from users can also be obtained by work group and passed on to the security manager. So if you want to designate somebody who may send the request to the security manager for the new users, that may also be helpful. So that is some of the options that are available. So again, just to recap some of the things that we briefly discussed. So access to PSYCKES is managed through the OMH Authorization Management System, since the security manager can log into AMS and grant PSYCKES access to staff by selecting the PSYCKES Medicaid dropdown option in their AMS user account. And every user gets their own user ID and token. And for individuals who have OMH tokens for other applications like NIMERS or MHPD, they can use the same token for PSYCKES. But if they do not have a user ID or a token, the security manager will create a new account in AMS, which automatically will generate a request for you to receive a user ID and instructions on how to request a token within the self-service console. So I just wanted to briefly touch base on granting access to PSYCKES. So how can a security manager do that in AMS? So once the security manager logs into AMS, they will see this users option located on the left-hand navigation menu. So when they select that option, this page is going to show up that says user search. So in order to create new users, they are going to select this add user option, and they can enter all of these information that is being requested, and they can select submit. So that is going to create an account for them, but there are additional steps that needs to be completed. So we ask that the security manager navigate back to the user tab and locate the newly added user, so they can they can search the user by their name or also their user ID. So next to the user's name, you can select edit, and the user's profile is going to open. And this is quite an important step because without this step, the user will not be able to log into PSYCKES. So you want to make sure that once the user's profile is opened, you can come down to this edit groups button right here. And once you select that edit option, it's going to show this user group page, and it's going to have the users, that's going to be their user ID. And then from this drop down, please make sure to select PSYCKES Medicaid. And when you select that drop down, this table is going to show up with these checkboxes, and you want to make sure that you are checking off the PSYCKES Medicaid option. And once you select update, now that is going to grant the users access to PSYCKES. So once access is granted, the user will receive an email from ams-do not reply at its.nyc.gov. And then the subject line will say granted access to PSYCKES Medicaid. And then the content is going to include the user ID, how to request and activate token through self-service console, as well as link to PSYCKES Medicaid. And if you'd like additional information on the AMS portal, like the CNDA, the MSSR registration form, the AMS portal, token instructions, we have listed the AMS website right here. So please navigate to that website and view these user guides as well. So just a little bit about requesting a token. So if a user already doesn't have a token, they will need to go to the self-service console to request one. So they can log into the self-service console, and in order to do so, you'll need your OMH user ID, and it's going to be in that PSYCKES access granted email. And as for the password, you have to create a new password using ny.gov. So we ask that you navigate to this ny.gov ID homepage, select forget password, and then you can enter your OMH issued user ID in the username box, and you can select reset using email. And you will be receiving an email from ny.gov ID at its.ny.gov, and it's going to provide you a link to reactivate your account, and it will ask that you answer 3 security questions, and then you can create a new password. Once you have a password created, you can go back to the self-service console using that user ID and password, and you can request for a token. And after a token request is complete, if the user does not receive a confirmation email that the request was submitted within 1 to 2 hours, they will need to contact OMH Help Desk at this phone number to verify their identity. And after the token request is approved, the users will receive an email with instructions on activating the token. So let's dive a little bit into revoking PSYCKES access. So if a staff member no longer requires access to PSYCKES, or if they've left the organization, the security manager will need to deactivate appropriate access in AMS. To deactivate PSYCKES access, we ask that you go back to the AMS system and select users and pull up the user profile and select edit groups. And when you select edit groups, it will take you to this user group screenshot that we previously saw. So in order to grant PSYCKES access, you would check this box off. But if you'd like to deactivate their access, we ask that you uncheck this checkbox next to PSYCKES Medicaid and select update. And this will deactivate PSYCKES access for this user. So this is only going to deactivate PSYCKES access, but if you'd like to deactivate PSYCKES and all OMH system access, you will go to the edit user page, and instead of selecting edit groups, you would come down to deactivate. And when you select deactivate, you have to make sure that you know that this is going to deactivate access to not just PSYCKES, but all OMH applications. So we ask that you double check that information and select deactivate. And if a user has requested a physical token, so that hardware key fob token, it does have to be mailed back to OMH, and we have the address located right here. All right, so that covers our training on obtaining PSYCKES access and pretty much where to get started. So from determining whether your organization is eligible for PSYCKES access or not, all the way down to granting access to individual staff members at your organization. So I did wanted to spend a little bit more time on training and technical support. So we do have additional resources available on our public website. So we have implementation resources. So that's where we have our example policies and procedures. We do have a dedicated webinars page where it's going to have a list of all of our recorded webinars on different PSYCKES related topics. So from role-based training to specific application feature training. So feel free to navigate through that as well. We have our PSYCKES user guide as well as short how-to videos that is more dedicated towards the self-service console and token request process. And now that you've learned a little bit about PSYCKES access, and once you're granted access to PSYCKES, you will be able to log in and use the application. So as you're using the application, if you are interested in adding specific features, please let us know. So you can email us, and we ask that you provide a detailed description of the feature that you would like to be added into PSYCKES, and the purpose that this new feature would serve, and how this feature could help a larger group of users. So we always are more than happy to receive any user feedbacks related to PSYCKES. So if you have any feedback or suggestions, please do not hesitate to reach out to our PSYCKES help desk. And for technical support, we do have a dedicated PSYCKES help desk. So if you have questions about PSYCKES eligibility for your organization, or if you have any questions about PSYCKES itself, please do not hesitate to reach out to our PSYCKES help desk. our help desk is open from Monday to Friday, 9 a.m. to 5 p.m. And as for the token related issues, so if you're having trouble logging in, and if you have some token related issues, we recommend that you contact the ITS or OMH help desk. So if you are an OMH employee or state PC employee, you can contact the New York State help desk. Or if you're an OMH or if you're a non-OMH employee, you can contact the OMH help desk at healthhelp@its.ny.gov, or you can also call this number as well. All right, so before we end today's webinar, I'm going to put the slide up in case anybody wants to write the information down, but I did wanted to check in and see if we have any questions that have come in that we can answer on live air.
Yeah, Ashma, we have two questions. The first one is, can somebody besides our CEO sign the CNDA form?
That is a great question. So the CNDA form can be signed by any other individuals at the organization, but it has to be made sure that they do have the legal authority to do so. And if the CNDA is being signed by the CEO or any other individuals, we ask that you just send us a quick email just confirming that the person who is signing the CNDA has the legal authority to do so. So yes, to answer your question, any other individuals at your agency can sign the CNDA can sign the CNDA as long as the CEO has designated them to do so and they have the legal authority to do so. Hopefully that answered your question. But if you have any other questions, please let us know at the help desk. But are there any other questions that have come in?
Just one more for you, Ashma. How many security managers should my agency designate?
That is a really good question, and thank you for bringing this up. But we generally recommend that there may be more than one security manager, so you can assign as many security managers that you would like, depending on your workflow. But we generally recommend that it be more than one. So in case one security manager is out of office, and if an individual would like PSYCKES access, there's going to be another security manager who can complete that task. So we recommend that there be multiple security managers just to help with the efficiency if PSYCKES users require access. So definitely you can assign more than one security managers. And in order to do so, you just have to contact your CEO and have them log into the CNDA portal and send them the AMSSR email. But any other questions that have come in?
Those are all we have. Thanks for those answers, Ashma.
Thank you so much, Cameron, and thank you all so much for all these questions, and thank you for tuning in. And again, if you have any questions, please reach out to us in our PSYCKES help desk. And thank you all so much for your time, and hope you all have a wonderful rest of your day.